member from Kitchener-Waterloo.
Thank you very much, Mr. Speaker. My question is to the Minister of Health and Long-Term Care. Since December, I have been advocating for the reunification of Patricia and Don Dayton. They have been married for 64 years but are being forced to live apart without each other because of Ontario's broken long-term care system. In fact, when I can, every Friday I've been driving Don to see Patricia. They are a loving couple and they miss each other. Mr. Speaker, the Minister of Health claims that a new reunification regulation has solved the problem, but the Daytons are still separated. In fact, Patricia's Lynn care worker has asked 387 residents to switch homes and make space for Don, but the list has been exhausted, and there is no hope for reunification in sight, and this is completely unacceptable. Can the Minister of Health explain why this Liberal government is saying that there is no longer a problem with couple reunification in our long-term care homes when Don and Patricia are still living apart?
Minister of Health, Long-Term Care.
Thank you, Mr. Speaker. And certainly stories as illustrated by the member opposite really touch us all, and I think we all understand very clearly the need for spouses to continue to live together whenever we can support them in that goal. And we know it's really important for families and for the emotional support that they need from each other. And so our government has been giving a very high priority to residents who are seeking to be reunited with a spouse or partner, and we're taking a number of steps to ensure this process is as smooth as possible for families. Now, we do know that there's more that we can do, and we recently made changes that designate a number of reunification priority access beds in every long-term care home. These beds will help to address delays in reunification for those in crisis to be reunified with their loved ones in a long-term care.
Supplementary.
Thank you. Again to the Minister of Health. The MPP for Nickel Belt has been trying to reunite 91-year-old Gottfried Adler and his 88-year-old wife Hildegard as well. The Adlers have been separated for over 6 months after 67 years of marriage. Like the Daytons, the Adlers are emotionally distressed because of their separation. Ontario's seniors shouldn't have to settle for a long-term care system that repeatedly breaks promises and hearts. Will the Minister of Health direct her ministry to reunite the Daytons and the Adlers today? I am asking for your direct intervention to help these families.
Be seated, please. Be seated, please. Thank you. Minister.
Thank you, Mr. Speaker. And I would certainly say to all members of this House, if one is aware of a particular situation in one's constituency, please feel very free to approach me to draw my attention to that particular item. I have operated like this since being the Minister of Community and Social Services, because sometimes there is a solution that can be found more readily. But as a systemic issue, going back to the fact that we do have reunification priority access beds, we do encourage families to work with their local LHIN partners to ensure that seniors do have access to the care that they need and the best quality of life in their later years. And we are responding to the needs of our growing and aging population. I've mentioned the number of beds that we are increasing over the next short time, and we will continue to work in this regard. Thank you, Mr. Speaker.